All right, so I'm going to do my trach cares and suctioning video here. This is my patient having a trach. You can suction through the trach, through the mouth, or through the nose, but I'm just going to demonstrate through, I think I'm going to demonstrate through the mouth. Yes, and then just demonstrate trach cares. So first thing with trach cares is make sure you have some nice clean gloves on. Check the chart, check the orders, do some vital signs, heart rate, respiratory rate, SpO2, all that good stuff. First thing you're going to do is have corrugated tubing connected to your trach, to a disposable bag, up to your oxygen source. We're going to hyperventilate the patient for 1 minute because they will be taking off their O2 for a while you're doing these other two procedures on them. So get that going for a minute, turn it off. There will be a old bandage, or like a bandage gauze on their trach. Take that off, throw it away. I would change gloves again at that time, make sure everything is nice and clean and sterile for the patient. So if they have an inner cannula that is not disposable, have some hydrogen peroxide that you can pop it in so that's clean, getting clean while you're doing these other procedures. If it is disposable, toss it, get some new gloves, and get a new one. Everything clean, clean, clean. All right, so remove the dressing, throw it away. Clean around the stoma. Have hydrogen peroxide. There's some little Q-tips in the kit and some cotton balls if you have those too. Q-tips can go up inside of the trach here. Get clean on the inside. You can use the cotton balls to kind of clean more on the outside of the trach, maybe kind of just the ring around it. Make sure to throw all those away and then probably get some new gloves again. That's what I would do. All right, if that inner cannula is disposable, put in the new one. If it's the one you cleaned, put that one in. All right, clear the stoma site as best as you can. All right, put on a new dressing. Grab your gauze, put on a new dressing. Everything will be nice and clean there and they will be happy. If you want to put back on your trach mask, make sure you have a finger length between the trach and the collar so that it's not too tight, but yet there's not a lot of leakage of any type of neb treatments, air, anything like that. Reassess your patient, make sure they're doing okay while this is going on. So next we're going to suction. You have a suction kit with some nice clean sterile gloves, your suction here. There will be a tube that connects to a vacuum that will also connect to a canister that's going to hold anything that you pull out with your suction. You want to make sure your dominant hand is completely sterile. This would be where I would have new gloves again. This is what's going to hold the suction and never touch anything else. This hand can do all the dirty work for you. Open it up, connect things up, whatever you need to do. So grab my suction. Okay. Now, kind of measure like mouth to chin. That'll give you a decent idea as far as how far down you want your fingers to be. I'm going to go like a 6 with this guy. He's pretty big. So if I was suctioning into the trach, I would put the suction in. When you feel resistance, pull out a little bit, suction. You're probably going to get some phlegm, some spit, maybe a mucus plug. If you're going through the nose, you can lube up your suction so that's a little easier to get in and out, get some of the ickies out of their nose. If you're going through the mouth, stick it into the patient's mouth, have them cough. Once you feel resistance, pull back a little bit. Anywhere that you're going to suction at, you want to do it for no longer than 15 seconds. Just try to get to the back of the mouth, kind of around the tongue, up to the top, maybe even under their tongue a little bit. Get any of that icky stuff out there. That just, you want them to feel good when you're done with this. All right, pull this out, discard. You throw all this stuff away. You don't need it again. Everything is disposable. Okay. So if you need a sputum sample, you could probably get that from your canister from after doing that. Otherwise, you probably just throw all that stuff away too once you're done with it. Okay. So done with that. He's been suctioned. His trach is clean. Got a new bandage. All that good stuff. You're going to want to oxygenate your patient again. Put that mask on and get them really oxygenated since they've been off of it for a little bit. Make them feel a lot better. And then they can go back to their normal routine of whatever they're doing. Do that again for 1 minute though. Reoxygenate. When you're suctioning, for an adult, you want the vacuum between 100 and 150. You don't want to be like sucking crap out of them so fast. But enough that it's going to get that stuff out of them. When you put your suction in, you want to go with inspiration. Like I said, have them cough or kind of breathe out. And when you feel that resistance, that's when you'll pull your suction out a little bit and you know you're in the right spot. Other than that, I think that's pretty good. When you're done, make sure that you dispose of anything that you need to. Wash your hands, chart, check the vitals, ask the patient how they're doing, if they're feeling okay, anything you can get for them. Make sure if they're on O2, it's set back to the right liter flow so that they start to feel a little better against being off of it. Um, Other than that, I think that's pretty much it. Just make sure clean, clean, clean. Change your gloves as much as you want. Plenty of gloves in the hospital. Make sure the stomach gets really clean. Suction out for no more than 15 seconds. All right, I think that's it. Thank you.